Everyone follow me? So you got to watch those subtle cues in your parents and yourself and your spouse, and get to it on diet and maybe some targeted supplementation. So yeah, but I think it's looking promising. It's a beast. Once that freight train gets moving, it's you can do a lot to slow progression, but that's where we're at. How far does diabetes go? 2005 study at Brown University identified why people with type 2 diabetes have a higher risk of developing Alzheimer's. In this kind of dementia, the hippocampus is insensitive to insulin. The hippocampus looks like a ram's horn in the brain, and it does two main things. Controls your circadian rhythms, which is having your brain wake up with the sun and send out signals to all your endocrine hormones to say, and go down with the sun where you get a good night's sleep. That's the first thing the hippocampus does, circadian rhythms. The second thing hippocampus does is short-term to long-term memory. Short-term to long-term memory. What do Alzheimer's patients remember? The 1940s. The 1950s, right? They no longer, you hope you got in with that relative early enough to be on the list, right? If you're a newbie in their life, it's Eric? Yeah, Eric. Mrs. Smith, Eric. Yeah. Because I'm a new guy, right? For that Fraser Meadow Alzheimer patient I'm seeing. So hippocampus does short-term to long-term memory and circadian rhythms, and it's insulin sensitive. Fuel can no longer enter the hippocampus to create energy, ATP, to run the hippocampus. So they can't run short-term to long-term memory anymore. Okay. And again, there's one thing I am not having my kids doing, that's change my diapers. Again, another reason to eat responsibly. But again, that's not why I do it at the end of the day. I do it at the end of the day because I enjoy energy. I enjoy vitality. So it's time to get through your food addiction and see how you feel if you eat really clean. I felt 10 years younger when I went off predominantly most grains. I still do rice in moderation. So, feeding animals a diet designed to give them type 2 diabetes creates insoluble plaques of a protein on their brains, beta amyloid. What Dr. Slavin talked about, insulin plays a key role in memory. And here we go again, this Alzheimer's being named by some as type 3 diabetes. The hits keep coming. This is what I want to show you. Number one killer of American men and women in the United States?
Heart disease.
Heart disease. More deaths from heart attack and stroke in females than breast and colon cancer combined. Okay? So why are we spending all that money on the mammogram and blowing off the EBT heart scan and carotid ultrasound? I don't know. Not that the mammogram is invalid. Getting mammogram and colonoscopy does pick up early detection and shows decrease in mortality from breast cancer and colon cancer. Colonoscopy and mammogram have earned their place. The number one killer of men and women is heart attack and stroke. So if you have family history of heart disease, you need to be coming to our clinic and talking to me about how we're going to rewrite history. Okay? That one is easy. The dementia is a freight train. At this point, heart disease prevention and treatment in our clinic is getting very easy. Okay, that's like the autoimmune ones and the seizures and all the other stuff. Still a lot of work on our part, but the heart disease, it's if you have a patient who wants to play and take the self-responsibility and the coaching, it's done. So here's the deal, but let's look at the dollars. So this is the number one killer, heart disease. This is the number one expense. The per patient cost of dementia is upwards from $45,000 to $100,000 a year per dementia patient. Okay, and then you think about the people who keep their parents living at home with them. That tells you how much of their own lives they have to sacrifice now to take care of their parents. It's a very noble job, but they don't get much reward for that. They don't get a paycheck. They don't get anything. So. Most common form of type 2 of diabetes is type 2 diabetes. I want to be clear, there's those type 1 diabetics who need insulin. That's also related to casein from dairy and gluten. We can talk about that another time. The most important one is 90 to 95% of all diabetes is type 2. Is type 2 100% preventable? Yes. Okay. What happened to the indigenous in America? If you go and practice on a reservation right now, and they do loan repayment for naturopathic doctors through government program. And I have classmates who practice there. You're treating type 2, obesity, alcoholism, and complications from diabetes. Okay, was Chief Niwot diabetic? No. There's an Arapaho bronze statue behind our Capitol, and it shows this ripped, lean hunting machine over a buffalo with a spear in it. And the most dramatic thing about it is seeing the size of a dead buffalo. You know the testosterone had to be running through that dude? Was he aromatizing his testosterone to estrogen as he was chasing down a buffalo with a spear? Seriously, you gotta have a pair to go out there and do that. I mean, that's nutty stuff, right? And those people were ripped lean, and they were lean and ripped into their 60s, their 70s. There were no low T centers, low testosterone centers around town, right? It was because they ate to bring glucose and oxygen to the cell, pack on lean muscle mass, right? As soon as the Westerners brought the sugar, alcohol, and grain, you had nutritional genocide. You killed a culture, and possibly unintentionally. I'm not suggesting it was out of malice. We killed a culture through feeding them sugar, alcohol, and grains. Okay. So here's the deal. Remember those triglycerides, right? You can't get that glucose into your cell because you've been making these very carby, sweet-tooth decisions. And you start making those triglycerides. Bad cholesterol, LDL cholesterol, which you're going to read in Grain Brain. If you want to start reading about how important cholesterol and fat is, this is the book for you. Bad cholesterol does things like carries healthy vitamin K2 and anti-dementia anti-heart disease vitamin into your body. Bad cholesterol is good, right? But it is a powder keg. So if you know, bad cholesterol is supposed to be under 100, according to Big Pharma, right? So they can sell more drugs. Train doctors to be reflexologists. If your cholesterol's over 100, bang, statin, right? You guys know that drill. Your bad cholesterol is 114. Bring out the statins, right? Well, this whole thing is a debacle, and Bill Blanchette and I are working on publishing on this because we follow with heart scans, and we follow with how many people are heart attacking and stroking in our clinics, and the stats are impressive. But we're waiting to accumulate more data, and then we're just going to tell it like it is. Bad cholesterol does not cause heart disease. I repeat, bad cholesterol does not cause heart disease until it is inflamed. Okay? So if your bad cholesterol is 40 or 120 or 200, it will simply bounce down the artery, causing no problems until it gets inflamed. Okay? What are some things that can cause inflammation? Spiking insulin through poor dietary choices? How about a tooth abscess? How about gum disease, where dirty mouth bacteria goes where it's not supposed to, into the sterile insides? Have any of you heard gingivitis causes heart disease? Right? How about migraine headaches? How about asthma? Anything inflammatory can turn that bad cholesterol molecule into an infectious-looking, oxidized, inflamed powder keg. And that's where the immune cells in your artery wall look like little Pac-Mans, and then they pounce and gobble. So in other words, if you're just a powder keg going down, doing, no problems here, but now I'm an inflamed powder keg. I'm living on Krispy Kremes and Diet Coke, right?
Cigarettes.
And cigarettes. Oh yeah, the good old cigarettes. And I hate my job. And I'm firing out inflammatory interleukin-6 because I hate my job, right? So now those powder kegs will get inflamed, and these macrophages will literally engulf that cholesterol, thinking it's an infection. It's just an inflamed bad cholesterol molecule. You start to build that plaque, then because the artery is damaged, you start building bone to try and protect the artery. Okay? Have you ever heard of atherosclerosis? In lay terms, we call it hardening of the arteries, right? You're building bone to try and protect an inflamed artery. And when I take Pulse over Fraser Meadows, I can feel the hardening of the arteries, right? They feel like there's bone in there, okay? So the way you get around this is you don't eat inflammatory foods and you keep your blood sugar stable. Dana put this one on here. This is trying to rehabilitate a cell with oxygen. Okay. Long-term complication of diabetes. So we got decreased oxygen to the brain due to cardiovascular plaque. So now you already swung your insulin, you got high triglycerides, your energy's a mess because you can't get glucose into the cell because your insulin receptors broke. All of your testosterone is going to estrogen in the males. All of your estrogen is going to testosterone in the females. You're both getting aggressive on yourselves in relationship. And on top of that, you're starting to clog the highway to deliver oxygen to the brain. Right? Everyone with me? What are the two things we need in our brain?
Oxygen.
Steady.
Glucose.
Awesome. So I always want you guys to think of the word steady before those. Because glucose denotes I can just eat a Krispy Kreme and jack up my glucose really quick. And we're looking for, as Jackie said, those country roads, not the roller coasters. All right. She was talking about glycosylation, and the word we like to use with patients is how sugarified is your system. How many of you have heard of hemoglobin A1C in a primary care visit at this point? So hemoglobin A1C is pretty cool because it's the lie detector for patients. They can come in for a fasting blood draw and eat really clean 3 days before the blood draw, and their glucose will totally improve. But what doesn't improve is their hemoglobin A1C, because it's how sugary did the iron protein in their red blood cell get over the last 3 months. Okay? So A1C is a 3-month snapshot of how you've been doing with our nutrition recommendations. That make sense? So in diabetics, you don't want your A1C to be higher than 7. That's good type 2 diabetic control. For staying away from diabetes, you want to be about 5.5. Okay? So I say, do your red blood cells look like healthy oxygen delivering cells, or do they look like Homer Simpson drippy sprinkled donuts? Right? You want these guys. Okay? One more thing on this guy. You can keep that guy up. Go to the next one. One more thing on this guy. When things start to get sugarified, the first thing to get damaged is the small arteries. Okay? How many of you know someone with type 2 with diabetes? How many of you have heard of cutting off the gangrenous toe of a diabetic? Right? That's because the arteries to the toe are far away from the body and very small. So you pick on the little guy first. This big honking aorta, it'll be calcified on your heart scan, but it takes a while to get that puppy. What gets messed up and sugarified first? The arteries to the eye, the small arteries in the kidneys, the arteries in the fingers and toes. Have you heard of peripheral neuropathy? Oh, thank you. We have an audiologist in the house. And she's saying to me, and the ears. Thank you so much for reminding us of that. You see the eyesight go down as you see the hearing go down. The #1 cause of blindness in the United States of America is type 2 diabetes. Is that crazy? To go blind when you absolutely didn't need to? You know, it's one thing if you're born blind, and in China, those folks get shuttled to be acupuncturists, interestingly, because they have such good tactile sensation. But to create blindness through Krispy Kreme is kind of weird. You know, it's kind of a real loss of self. Okay? Dialysis centers. How many of you have heard of dialysis centers? Mainly type 2 diabetics in there. We wouldn't need dialysis centers if we're talking about that $245 billion debt. You sugarify the arteries in the kidneys, and you damage your kidneys so much that you can't filter toxins out of your body anymore. So they plug you to a big kidney machine that pulls your blood out, filters the toxins, and puts the clean blood back in you. The second you get off that dialysis machine, you're toxic again until you're back in the dialysis center. Okay, rough. You have to have a port, a hole into your kidney, right? Pretty rough. So, gluten in the immune system. Now let's talk about more the antigenicity or the allergenicity or the sensitivity. This is where, again, your own immune system thinks gluten's the swine flu or infectious looking and puts an antibody tag on that, marking it for destruction. Okay? Patients with enteropathy, that's pathy is pathology of the entero, the guts, disease of the intestinal tract, represent only a third of the patients with neurological manifestations and gluten sensitivity. I will tell you that's BS. They represent about 5% of the patients. Okay? It gets way worse than this, but the whole point is you don't have to have raging diarrhea and bloat all day to have a problem with gluten. We've seen eczema clear. We've seen bipolar improve. We've seen dementia slow down its progression, getting off the gluten. Next one. The current ratio of clinical diagnosed, Dr. Slavin talked about that. Undetected cases, the size of the iceberg is approximately 1 to 8. They're talking about this is what we're detecting on the gluten problem, and this is the real size of the problem. Oh, and by the way, this is my favorite. This is a medical journal called Gut. So everything we're saying from here for the rest of the presentation is from peer-reviewed medical doctor and MD, PhD journals. Okay, this isn't naturopathic stuff. You know, most of my data comes from MD journals, and I'm the one practicing it. It's kind of weird, you know. For every symptomatic patient with celiac disease, there are 8 patients with celiac disease and no gastrointestinal symptoms. I was going to talk to Dana about these need to have frowns. I have ADHD. I have eczema. I got migraines. We can't make babies. I got heart disease, you know, so on and so forth. So, it's not good times, you know. In the last year, work has shown that the prevalence of celiac disease has increased dramatically, not simply due to increased detection. So in our clinic, it's both. We're having dramatically improved detection abilities. I'll get to that in a second. And people are getting weaker and they're getting more reactive to gluten. I'll go over that in a minute. Celiac disease is a global health problem that requires a multidisciplinary and increasingly cooperative multinational research effort. Some of my favorite papers come out of Italy. PubMed Italy and gluten, the public medicine search engine that your tax dollars pay for, and about over 1,000 studies on gluten out of Italy. They have a public health program that screens for this. Why? Because they're great for their people? No, because they know the cost, right? Alone, celiac has increased blood cancers, leukemias, and lymphomas, and increase in autoimmune diseases. You put a dollar cost on that, it makes a lot of sense to start screening for gluten in 2-year-olds. Right? So, again, gastroenterology.